In students in the classroom, if you want to leave the Google Meet, you can. All right. So our pig, I'm actually going to say for this afternoon. This is Louie. Louie is another group's pig. We're going to dissect. We're going to dissect Louie today. And we'll see our pig again when we come back. But I have a lot of students missing today for AP testing, and so we have an opportunity to cut into 2 pigs. So I'm going to take that opportunity today. So this is Louie. Louie has not yet been dissected in the abdominal cavity, but we're going to just move up to the thoracic cavity today. Before we do that, though, does anyone have any questions, comments, anything around the abdominal cavity? No. Okay, as always, if you do have questions, comments, anything, please, it's so much more fun for me when you guys are talking and interacting, so please feel free to turn on your mic and say something. I can't see the chat, so mics are the best way to go. All right. So I am going to start, I'm actually going to start up here in larynx region, and then I'm going to kind of work my way down. And I'm going to start cutting kind of gently. I'm going to try and go from a different angle so you guys can see a little bit better today. So what am I going to have to cut through, like down here? You're going to have to cut through. That might be a bit of an interesting. Oh, I can't see the chat. Yes, the sternum. Again, if it's possible for you guys to turn on your mics, I would appreciate that, just because I can't really see the chat when my camera's at this angle. If that's not possible, then the chat is better than nothing, but maybe you guys could help me keep an eye on the chat. But yeah, we need to cut through the sternum in order to expose the heart and lungs. Yeah. So we'll see that in just a little bit here. We're getting close into Louie's thoracic cavity. Starting to see some glands. I'll point those out to you guys in just a second. Right now, I'm mainly cutting through muscle, fat, skin, obviously. A lot of muscles around this part of the body. What are some of the muscles that we know of that are around the thoracic cavity? Back to our last unit. Muscles, anyone remember? What are some of the muscles that help us breathe? What are those called? Yeah. That's fine. Yep. That's totally fine. Yep. See, yep, that is totally fine. That's fine. Yeah, that's fine. That's fine. That is fine. Anyone remember the name of the muscles that are surrounding our lungs? There's 2 main sets. One is external and one is internal. Anyone?
Is it our intercostals?
Good, yes, our intercostals. So we've got the external intercostals and then the internal intercostals. Inter is like between. Costal is rib, which you'll be able to see some of the ribs here in just a little bit. Okay. I'm still trying to be a little conservative as I cut here.
It's so cool how all of that nutrient can go through that small of a tube.
It is cool. That yeah, the tubes are very small. They're talking about how.
Are they that small?
They're bigger in people, but not like they're very proportional. If that makes sense.
Yeah.
We're talking about how the intestines are is not that big around. Pretty cool. Trying to feel now for the diaphragm. We cut through the intercostals, cut through some ribs. I'll show you guys it in a little bit. You can feel them. They're kind of tough to cut through as well. You can you guys hear that? That's that like bone tissue. And I just cut through the pericardium. Cardio means what? What does cardio mean? You guys know this. Cardiovascular. Cardio. What does cardio mean? Anyone? Bueller? Allen? Celeste? Bella? Anyone?
Sorry, did you ask what cardio means?
Yes. Yes.
Oh, heart, right?
Yeah, exactly. Cardio is heart. I know it's not ideal to see. If you guys can put me on speaker view, I think that's what it is, and you'll be able to see a lot better. If you're like, this is really hard to see, try and get like most of the screen on me. Okay, we are getting there, everyone. We're about to take the heart out. So you might be able to see here, these are the ribs. Okay, so these right here are the ribs, and then in between the ribs, you can see that intercostal muscle. It's kind of hard to see which direction they're running right now, but that would help to tell us which are the internal intercostals and which are the external intercostals. And now I am trying to cut down. Good job. You guys can put them off to the side. I'll come get a picture of you guys later if you want. Okay, good. And then now we're going to try and get to some lungs, and then we'll start taking some stuff out of here. It's a lot of, the more developed the pigs are, the tougher the bones are, as you might imagine, because they're more hardened. Remember that the bones go from cartilage to turning into bone over time with development. Okay. So a lot of tissues surrounding these organs here in the thoracic cavity. So you can kind of see these tissues like right here, the pericardium. This is surrounding the heart. There's also a layer of tissue that's directly on top of the heart. And just like the lungs, the heart also has these like 2 layers of tissue that are surrounding it with fluid on the inside to allow for an easier like beating process, because remember your heart's constantly beating, and so if it weren't for the fluid, there would be a lot of friction in the tissues surrounding the heart, which would be very painful, and that is actually a condition people can have.
Yeah, that's
Pericarditis, I believe, is what it's called.
There's a dissection where it asks to identify the pyloric and something valve. Is that the heart?
Those are in the stomach. So if you cut into the stomach, you'll be able to see those.
Oh, I'm supposed to cut into the stomach.
Cut into the stomach. Okay. Trying to preserve some of our blood vessels. Louie's got some significant amount of tissue in here for some reason. Because that's not normal. Louie's not abnormal. Okay, there we go. Put some of this loose. All right, we can start to kind of see in here these different vessels. And the lung tissue as well. And I'm gonna move my fingers in just a second so you guys can see more. Okay. So before I really start to go to town in here, this right here, what do you guys think this is here in the center?
Is that not the heart?
Yeah, that's the heart, exactly. That's what all that tissue was surrounding, is the heart. And then on either side of the heart are the lungs. And the lungs are one of the things that students are always like, what? I had no idea that they look like that. And they don't look very big from the anterior angle. And in just a second, when I take them out, you'll be able to see that they are quite a bit larger than this. But the lungs are all of this surrounding tissue right here. These are the different lobes of the lungs. Pigs have a different number of lobes than we do in their lungs. But here's the heart and then all of the lungs surrounding here, okay? I do believe, is the first one the heart dissection or is it the lung? I think it's heart, right? Dissection 4. Is that the heart? Yes, no, maybe so.
Yeah, it's the heart.
Okay, cool, thank you. So I'm gonna cut the heart out first. Before I do that, this one actually.
Oh my god. That is so rough.
Did you just cut open the stomach?
Yeah.
Yeah. Okay, so this, I don't know how easy this is to see. Hopefully you can kind of see it, but do you guys see this blue thing right down here?
Yes.
Yeah, that's the inferior, this is the inferior vena cava. So remember, that's that big blood vessel from down in the lower part of the body that's bringing blood back to the heart. And I already cut through it, but up here is the superior vena cava that's bringing blood into the heart. The aorta is also here. It is difficult to see in this pig because there's a lot more blue latex than red for some reason. I've been doing a very good job with dyeing their pigs here. So in order for me to take the heart out, I'm gonna have to cut away a little bit at the connections. You're almost done with it. Once you cut it open, there's not much left to do. So I've got to cut away at the connections that are between the heart and the lungs. Does anyone remember what those are? Some of us tried to forget all of this as soon as we could. But.
Wait, can you repeat your question?
Yeah, what's connecting the lungs and the heart? So I'm having to cut it out here, right? So what am I having to cut through to disconnect the heart from the lungs?
I could be wrong, but is it the diaphragm?
Ooh, good guess. The diaphragm is the muscle down here.
Is it the pulmonary like valves and arteries and stuff?
Yes, yeah, exactly. The pulmonary arteries and pulmonary veins. So you can, this is actually a pretty good shot. I might have to take a picture of this. I just cut the heart out, which we'll dissect in just a second. But here we can see some of the main blood vessels that are bringing blood back towards the heart. But then do you see these little blue dots here?
Mm-hmm.
Yeah, these are actually the pulmonary blood vessels. So these are what's bringing blood out towards the heart and away from the heart. can't tell which are which because literally everything is blue, but pulmonary blood vessels there that are bringing blood. I'm sorry, I said to the heart, to the lungs, from the heart to the lungs, and then from the lungs back to the heart. So that's pretty cool. At least I think it is. All right, we'll look at the lungs again in a little bit, but for now, I might scoot Louis out of the way and go grab a paper towel and look at the heart. Does that sound like a plan? You got your intestines unraveled? Woo! You guys can put those aside, and I'll take a picture of you guys later on with your. Wait, so for the stomach? Yep, just kind of like cut it open. I don't. Ooh, get a different chair. Yeah, if you guys want to move on to cardiovascular.
Yeah, well, I usually help with the stomach because
Okay. Do me a favor, put the stomach off to the side and go ahead.
Yeah, that's
Yeah.
what I'm
Okay.
gonna do. But
Yeah.
how do I cut through this hard stuff?
You just use the razor blade, use some force. You gotta cut through the sternum, that's what that is. Okay. Alrighty, here we go. Heart. So this is anterior view of the heart. So if we're looking at the ventral side of the pig, this is how we would be seeing the heart. We can kind of see the four chambers here. So up here, this is the top, from the pig's perspective, top right chamber of the heart. So what chamber do you think this would be right here?
I'm sorry, is it the right atrium?
Good, yeah, right atrium. So here's the right atrium. Right ventricle is down here. Left ventricle down here. And then what would this be right here?
Left atrium.
Left atrium, good. And then we have some blood vessels here that I'm going to kind of rotate this so you can see everything from the maybe like the human superior, but the pig anterior side. So you can kind of tell here, this is one of the main blood vessels that's going either towards or out of the heart. And then so is this one. I know it's like really hard to see because it's on like a tiny little camera and you've never seen this before, but like kind of thinking about the differences. Oh boy. I'm trying to take the blue stuff out and it's not working very well. Kind of thinking about the differences between arteries and veins. What would you say, like this here versus this? Any guesses as to which would be an artery or like a main artery and which would be a main vein?
There's like a sac at the heart of them.
Yeah, it goes cut through that. Oops, sorry. So going in and out of view. I know it's really hard. Oh, go ahead.
Do veins bring blood to the heart or away from the heart?
Yeah, veins bring blood back towards the heart. But what are some of the other differences between arteries and veins that we know?
I'm sorry. So like our left would be like the vein, and the right would be the artery. Because they're like the arteries are thicker, right?
Good. Yeah, exactly. So this right here is the aorta that's coming up and out of the heart. So the aorta, look how thick that is, and that's really thick because it needs to withstand all of the what? Of the blood.
Oxygenated.
It is oxygenated at this point, but it needs to like, be able to not break under any other guesses.
Like it needs to be able to withstand all the pressure.
Yes, exactly. So there's a ton of pressure when blood is being forced out of the left ventricle and up and out of the aorta. There's a ton of pressure in that blood that's exerting on the walls of the blood vessels. And so the aorta needs to be much thicker than this, which is the superior vena cava, bringing blood down into the right atrium. This is so thin, and I know it's really hard to tell because of the latex in here, but it's so thin that like I tried to rip away at like, I tried to take some of the latex out. I don't know if you guys can see that or not. And then like I started to like rip the walls of the veins or of the vena cava because the walls are just so thin. Right? Yeah. There you go. You can kind of see that now. Like, look how thin that is.
Sorry, it's they like pump. You said like latex. It's like kind of rubber.
Yes, exactly. So like I just took out a little chunk right here. It's like kind of rubbery stuff.
Oh, okay.
Yeah.
I thought it was just dye.
No, yeah, they actually pump latex through, and we'll see a bunch in the heart. There's usually a bunch of latex you have to like take out of the heart, so we'll see that in a little bit. Usually it's supposed to be that they pump red through the arteries and then blue through veins, but my pigs lately have not looked very good in terms of distinguishing between arteries and veins, which is a little
And
annoying.
just a clarification, you said that the arteries are thicker than the veins, right?
Yeah, exactly.
Okay.
Arteries are thicker than veins because they need to be able to withstand more pressure. So yeah, some of the main blood vessels, vena cava, aorta. This is the inferior vena cava, which on the pig is like kind of positioned a little bit differently because of their positioning as being quadrupeds versus bipeds. But very similar still to humans. And then all of these smaller ones, we're not going to be able to distinguish between these, but these are all those pulmonary blood vessels that are bringing blood from the heart to the lungs or back in. Any questions on anything on the outside before I start cutting into the heart? It's kind of cute, right? Oh, maybe not. I think it's pretty cool. Okay, I'm going to start cutting through here. I'm going to make a frontal or a coronal cut. Coronal is called a coronal cut because it makes it very easy for us to look at what's inside the heart. So that's kind of where it got its name from. Sorry, I know it's hard for you to see what I'm doing. But, so basically just like opening it up like a fillet here, for lack of a better description. So this here, these are both of the ventricles inside the heart. So over here, we have the right ventricle, and then over here, we have the left ventricle. So notice which chamber is larger, the right ventricle or the left ventricle?
The left ventricle.
Yeah, left ventricle is much, much larger. And why is that? Think about what the right ventricle versus the left ventricle like do.
Well, I think it's because like it has to pump blood for like longer, around the body more, I guess, and like more pressure, I guess.
Exactly, you got it. So like it needs, excuse me, it needs to be pumping blood way further than the other ventricle does. So remember that the right ventricle is just pumping blood into the lungs. The left ventricle, though, is pumping blood through the entire body. And so in order for it to do that, it has to have much thicker walls and be able to, like when it contracts, exert a lot more force to get all of that blood up and out. Whereas the right ventricle is just going to be pumping blood up through into the lungs, so it doesn't need nearly as much force. So this is all that latex I was telling you about. I'm going to try and pull some of this out so we can actually see like inside the chamber. This is a pretty good shot of the start of the, it looks like the aorta. Yep, this is the aorta going from the left ventricle up and then eventually out. I just cut through it, obviously, so we can't see as much. Yeah, you see all that latex? Ooh. It's hard to get the latex out without really damaging the walls of the chamber, but I'm gonna try as best I can so we can see it. Okay. Again, don't have this one's really, usually it's a little bit easier to just pull the latex out, like it just kind of whoop, pops out, but this one is really bad. I have some much better pictures from my last quarter class, so I'll probably share some of those with you guys. That being said, there are still a few things that we can see in here in terms of valves. There we go. So usually I have a much better shot of these. I've got a really great picture of these from last quarter, so I'll make sure I share that with you guys. But in between all of these different chambers are the valves, right? And then in order to keep the valves in place, there's these little heartstrings, kind of what we call them, that are like making sure that the valve doesn't like fly too far back, and then allow blood to flow backwards. So here are some of those. Sorry, if I'm like too low, please tell me, guys. Can you see these little like string thingies?
Mm-hmm.
So, do you remember what those are called?
Capil.
It starts with a C. It does start with a C.
Capillaries.
They're not capillaries. Capillaries are the blood vessels that are like the tiniest in all of the vessels. Anyone else? Alan, do you remember what the little strings are called? Bella, Ray?
I like remember it, but I don't remember it.
I know. It was a while ago. The chordae.
Tibia.
Chordae something. It starts with a T or something.
Yeah, good. Yeah, the chordae tendineae. So you can kind of see those little chordae tendineae there. Those are the heartstrings that are holding onto the valve. And then they're connected to teeny little muscles in the walls of the heart. Again, I know it's not the best view, but like the little kind of bumps that you see down in the ventricles here. Anyone remember what those muscles are called? Sort of the P.
Wait, can you say that one more time?
Yeah, the muscles that the chordae tendineae are attached to. Does anyone remember what those are called? Going once. Going twice. I know it's hard when you guys don't have to actually ever memorize anything. You're just looking back at formatives. Those are the papillary muscles. So the papillary muscles are what connect to the chordae tendineae. So that's like what this is right here, connected to the chordae tendineae. And when these contract, it can like pull the valve down to allow blood to flow down. Little heart. Atria are very small. So like, as you can tell, I mean, these are the two ventricles. The atria are much, much, much smaller. So like one of the atria, this right here is one. This is the left atria. And then the right atria is even smaller. It's like full of latex, which is kind of annoying. But it's this chamber right up here. Cool. Any questions on the heart before I take out the lungs? All right, I'm going to bring this back.
What is this valve? It's up in front of the diaphragm.
That's actually, that is the inferior vena cava, bringing blood back up. Yes, isn't that cool? All righty. So I'm going to do a little bit more cutting here. We'll get our lungs out. I already cut through my trachea, which I didn't necessarily mean to do, but I did. Oopsie. So, here we go. I'm going to try and kind of lift these up and out. They look small from this angle, don't they? Don't they look tiny? They look so small. So I'm going to just kind of cut away at the tissue that's holding the lungs in here. This is the parietal pleura. That tissue, kind of like we were talking about, it like has that water layer in between, like outermost layer of the lungs, and then that surrounding layer that's like connected to the rib cage. And when that changes, when the muscles contract to change the size of the thoracic cavity, the lungs kind of just go along with it because of that water layer in between those two membranes, which is all because of, it all sticks together because of hydrogen bonding for any of my chemistry fans out there. Hydrogen bonding. Okay. Come here, lungs. Get out of there. We'll connect it just here at the very bottom. Almost there. Get out. Get out, lungs. There we go. A lot of, as I was just saying, you know, a lot of things connected down here with the, oh, ooh, look, there's more latex. So that was just coming out of the aorta. That's where there's a little bit of pink there. We tried, kind of. So this here, the aorta is running on the dorsal side of the lungs from the heart. So yeah, here is the aorta. I could pull the latex out of there. Woo! Very cool. Still, again,
That was really satisfying.
I know, wasn't it? Ooh, I could pull that out too. Yeah. Oh, there we go. So now we get a good shot of aorta and vena cava, and you can see the difference in size between those. All right, here's our lungs. I'm going to scoot Louie over. We'll take a look at those. Okay. A lot of, there's some glands on here that we didn't talk about, so I'm not going to focus on those. Some other tissues, some other connective tissues. I'm just going to cut those off so we're not confused on those things. Don't worry about all that. Okay, so if Louie were like standing on four legs, the lungs would be positioned in this way. So the more smooth part of the lungs is up against the rib cage. And again, remember there's like a thin layer on here, some fluid around that, and then another layer that's like on the inside of the rib cage. So whenever the rib cage expands, the lungs are going to expand also. If I could, I would like stick, one of my favorite things to do is to actually stick a straw down into the trachea and blow it up, but it doesn't work well with the preserved tissue because it's kind of been hardened, so it doesn't expand as well as fresh tissue does. Again, pigs have a little bit more of a different structure than from humans in terms of the lobes of their lungs, but we do have fewer lobes on our left lung than we do our right lung, and that's because our heart is kind of positioned on the left side of our body. And then this is the ventral side of the lungs. So yeah, isn't it like you usually picture lungs as just like these two like whole things, but really they've all these different lobes. It's like really trying to maximize space inside the thoracic cavity as much as possible. Okay. Any questions on, there's not much to see with the lungs, obviously, other than just being able to recognize right lobe, left lobe, and then we'll look more at the trachea in just a little bit because I cut through it in the thoracic cavity. But any questions, observations, anything around lung tissue? Cool. All right, I'm going to set our lungs off to the side. I'm going to bring Louie back, and we're going to look just a few more things. And then I'm going to make some rounds around the classroom here, okay? So I'm going to cut through some more of this tissue. Again, there's a lot of tissue here that we never really talked about, but I do want to make sure I can find the trachea and show that to you guys because it is very cool. I think I'm getting pig juice all over my watch right now. It's like my AirPods. Oops. Okay. This is the last thing. Oh, go ahead. This is the last thing we're going to look at today. Okay. Okay, so we have a little bit more tissue, and then we'll do a little bit of talking about what's up here, and we'll be done for today. Cool. All right, here we go. So, you guys see that kind of okay? It's not ideal. Here is the larynx. Does anyone remember another term for the larynx? Alan, did you know your mic is on? All right, so anyone larynx going once?
The voice box?
Yes, good, the voice box. So this right here is the voice box. I know we didn't get to look into too much depth with this, but there's flaps in here that move around when air comes out of the trachea, out of the lungs, through the trachea and then out of the body. And depending on how big those flaps are, that's like when they vibrate, they make noise. And then depending on how big those flaps are, that determines the pitch of your voice. So if they're really big, you're going to have a lower pitched voice. This is also called the Adam's apple. There's some hard cartilage in here that's protecting the voice box and protecting those flaps. Because, it's evolutionarily a pretty critical part of our anatomy. You can see down. Can you guys see what I'm pointing at right now, or is my doing it?
Yes, we can see.
Okay, I don't know how easy it is to see, but can you kind of see that those are like stripes right there? Yeah, so those are the little C rings that are made of cartilage that are holding the trachea open. If it weren't for these, the trachea would collapse during the pressure and volume changes of the lungs, and then we wouldn't be able to breathe. So we have these little cartilage rings that line all the way up the trachea and go further down into the primary bronchi to keep the airways open. Okay. So that's really all I wanted to show you guys. Larynx, trachea, lungs, heart. Do you guys have any questions before I make some rounds around the classroom here? Okay, I'm going to mute my mic, and I'll be back in just a few minutes. You guys kind of know what you can be working on in the meantime. I'm going to stop presenting. Thank you all. There it is. Oh my.